Hello everyone, I am Dr. Sushmitha Pittala, consultant radiation oncologist at Prathima Cancer Institute. So today in this video, I am going to talk on two important diseases, that is cardiovascular diseases and cancer. So as you all know, these two are the major causes of death worldwide. Most of us in future will die either of cancer or cardiovascular diseases. Even after the era of COVID-19 that shook the world, this cancer and cardiovascular diseases remain the leading causes of death. So in this video, I am going to emphasize on two main hypothetical statements, that is cancer would cause cardiovascular diseases and cardiovascular diseases would cause the cancer. So certain decades ago, some theories were proposed and some observations and retrospective analysis were done to establish the association between the cardiovascular diseases and cancer. There are certain risk factors which cause risk for both the cardiovascular diseases and the cancer. For example, like age, sex, certain genetic factors, smoking history, obesity, diabetes, all this will increase the risk of cancer and as well as the cardiovascular diseases. So there will be a significant overlap. So if you are exposed to one risk factor, then the chance of developing, if you are at risk of developing one disease, then the chances for developing the other will also increase if you are having these risk factors. BRCA mutation, this will cause the breast cancer and keep both the mother and the daughter at risk of developing breast cancer. So these genes are nothing to do with heart attacks, but certain decades ago, mapping of genes was done in heart attack patients and they found that most of the genetic locus were on the chromosome 19. These results surprised the physicians because this particular genetic locus has nothing to do with either smoking or obesity or diabetes. These genes are well known to cause the cancers like melanoma, brain cancer and lung cancers. This is just an accidental observation, but I would suggest one more theory that would strongly emphasize on the association between the cardiovascular diseases and cancer. That is nothing but the new concept of inflammation. So, in the medical schools, we were taught that the cancer is cells dividing too quickly, whereas the cardiovascular diseases are caused due to accumulation of cholesterols in the body. But in the new era of medical science, it is taught that these both diseases, that is cardiovascular disease and cancers, will share the common pathogenesis, that is nothing but the influx of inflammatory cells, immune cells, or new blood vessels. Till now, what all I was talking were just an observations. So if you ask me, is there any clinical data to support this, then I would say paper which was published out of German data. So they studied upon 100,000 patients who had heart attacks and they assessed the risk of developing the cancer. They found that these people who are with cardiovascular diseases had a much higher rates of developing cancer. So this suggests that indeed having one disease will put you at a risk of developing the other disease also. So, but this paper also put forward an important scientific scientific principle, that is causation and association are not the same. If we want to test this particular hypothesis, then we have to do an experiment on healthy individuals. So we have to intentionally give them a heart attack. Then we have to look upon the changes that happen in the body and see if in tumorigenesis happens in these patients or not. It is difficult to do these experiments in the humans, but all over the world, these experiments are being carried in mouse models in the research laboratories. What they did is they implanted these tumor cells in the mice and studied the risk of developing cancers. So they found that the risk of developing cancers is higher in the mice which had cardiac events than that, suggesting the presence of heart disease is sufficient to accelerate the cancer growth. So after hearing all this, if you have to ask me why is it that important to know the association between the cardiovascular diseases and the cancer, then I would say if we want to control the cancer, it is important to control the cardiac events also. So I would suggest to control the cardiac risk profile. For example, cancer treatments include a multidisciplinary approach which will include the surgeries, chemotherapies, radiation and all. So if you have to tolerate all these treatments, then You need to have a good heart. If you are having cancer and if you want to undergo a surgery, then if you are having any pre-existing cardiovascular diseases, then it would be difficult for you to undergo surgery if you are not fit for the surgery. Same with the chemotherapy also. If you have to take some chemo drugs, most of the chemo drugs will be cardiotoxic, and if you are having pre-existing cardiovascular disease, then it would be difficult for you to receive those chemotherapy drugs. Same with the radiation also. If your tumor is nearby the heart, then it will be difficult to achieve the heart constraints. So pre-existing cardiac diseases will stop you in taking the complete cancer treatment. Around 10% of the cancer survivors will die of cardiovascular diseases. So just don't beat the cancer only to die of cardiovascular diseases. Just have a healthy heart is a key to healthy life. So take care of your heart, stop smoking, do daily physical activity, eat healthy diet, monitor BP regularly and less salt intake. Take care of your heart. Happy World Heart Day.